This is the BSL2 Biosafety Training for non-science staff. I am Dr. Terry Lynn Hamby, Director of Science Laboratories. You need this training because you access laboratories where bacteria are housed and used. This training will help you identify hazards and learn to keep yourself safe when working around bacteria. BSL is biosafety level. There are 4 levels, with 1 being the least hazardous to 4 being severe. For each biosafety level, there are specific systems and safety items that must be in place. We will start with BSL4. BSL4 labs will have all of the requirements of the previous level. This level is like what you see on television when actors have on full containment suits and supplied air. Staff are vaccinated if possible and medically monitored. When working with bacteria such as Ebola, exposure will most likely kill you. Organisms in this level may not have a vaccine or treatment. There are 14 BSL4 labs in the United States. BSL3 labs require 2 sets of doors to enter the lab. Personal protective equipment is worn and respirators may be needed. In this classification, there are vaccines for organisms, but staff are still medically monitored. Sinks and eye wash stations must be hands-free. BSL2 labs work with organisms that are found naturally in the environment and can pose a moderate threat to healthy adults. In BSL2 labs, personal protective equipment must be worn. The lab must have self-closing doors. The lab is restricted when organisms are in use. An autoclave is used to sterilize organisms and lab items to prevent organisms from being released into the environment. Hands must be washed before leaving the lab. In our BSL2 lab, we have 4 organisms with this classification. To enter a BSL2 lab, you must have training. At Atlantic Cape, the following labs are BSL2. Mays Landing, S107 and S111. At Cape May, 302A and 305 have this classification, and there is no BSL2 lab at Atlantic City. BSL1 labs use organisms that generally do not cause disease in healthy adults and pose minimal hazards to the environment. These organisms can be used in any lab at Atlantic Cape. As a best practice, these organisms are autoclaved after use along with contaminated lab items. Personal protective equipment is to be worn and hands washed when exiting the lab. Working in a BSL2 lab at Atlantic Cape. When entering one of the listed lab rooms, be sure that you are properly dressed. Sturdy shoes that cover the entire foot must be worn. Long pants or skirts that cover the legs are to be worn. Safety glasses and gloves should be worn. Leave food, drinks, and personal items outside of the lab. This includes gum and mints. If needed, aprons are available. Once you are in proper attire, survey the work area for spills and/or hazards. If there is anything, contact lab staff for assistance. Do not touch your face while in the laboratory. Do not use your cell phone while in the laboratory. After completing your work, aprons can be disposed of in the regular trash. Gloves are to be placed in the bucket on the cart at the front of the lab. Wash your hands. When leaving the lab, check that the door is locked. Ideally, work should be completed when class is not in session. If you injure yourself while working in the lab, contact security and lab staff. In addition to a security report, an incident report form is to be completed for the lab. This is for your protection and tracking of any potential exposure. If you have any questions or concerns, please feel free to contact me at thamby@atlanticcape.edu, or I can be reached at extension 5025.